I'm waiting for 2 more minutes.
Yeah, so good evening, everybody. Today we have this excellent talk in continuing with our introduction series on sterilization and disinfection from laboratory to hospital-wide services. Now, these are extremely exam-oriented, important topics. And without wasting any more time, I'll hand over the presentation to Dr. Renu Gupta, who's working
Thank
at
you.
IBAS.
Thank you, Dr. Sonal. Thank you. So now, because you have joined in the evening session, without wasting much of your time, we will straightway start this lecture. Today, we are discussing a very important topic. As Dr. Sonal said, that it is very important from the examination point of view, and it is also very important from the clinical application. This is a application-based topic, and you will need it as a microbiologist for your entire life. It will go with you throughout your life. So we will be just talking about, you all understand as a student of microbiology that if any microorganism enters into bloodstream because of any breach in disinfection or sterilization, it can create havoc. A patient can die because of surgical site infection. So sterilization and disinfection is very important to get rid of microorganisms which are present on any of the devices. So this is a very important lecture today. Today in this lecture, you will be learning about the importance of cleaning, disinfection and sterilization. I will be telling you about the broad concepts. In sterilization, you will understand how the work flows in the sterilization operations, because as a student of microbiology, you know we need sterile media. Similarly, we need sterile instruments. So, sterilization is important in laboratory, in the hospital-wide services. We will understand how this work flows in the central sterile supply department. What are the different methods of sterilization? We will be learning quality assurance in sterilization operations. We want to be sure of our practices. We will be just having a brief overview of the CSSD layout. In disinfection practices, we will be looking at high level disinfection, intermediate level disinfection, low level disinfection, and we will also be understanding how do we monitor the efficacy of the disinfectants which we are using. So, the basic difference between cleaning, disinfection, and sterilization, which all of you should understand very well. Cleaning is just the start of a process. By cleaning, we are removing the foreign material, your organic material, your bioburden by the means of any physical action. It can be rubbing, scrubbing, or friction. It is physical removal of microorganisms, both organic matter and the inorganic matter, by the action of the physical rubbing. You can use any detergent, you can use any enzymatic cleaner. Disinfection, it means you are inactivating microorganisms by the use of some heat you are boiling, or by some chemicals you are using. Your UV light can be a disinfectant. And disinfectants are further classified into high level, intermediate, and low level of disinfectant, which we will see. Sterilization is an advanced process of making an article or a surface free of microorganisms. It also takes care of the spores. So if I put it in a more simple language, we can see that cleaning is removal of visible soil, visible dirt from any object or any surface. We do cleaning of our environment surfaces, our floor, our walls, ceilings. Disinfection is just you have started the job. You have started killing the microorganism, and sterilization is a job well done. You are taking care of spores as well. So this is a continuum of action. When we talk about sterilization and disinfection, we first of all try to understand about the susceptibility of different type of microorganism, and on that basis we decide which all microorganism will be killed by this disinfectant or not. You just try to see the spectrum of the action of these disinfectants or sterilants on different type of organisms. As you can see, viruses, especially your enveloped viruses, They are very, very susceptible. They are easily killed. Even your low level disinfectants like your chlorine, as you saw in the COVID-19 pandemic. This COVID-19 virus is an enveloped virus. So because of the envelope, it has got a lipid layer, which is easily destroyed by simple chlorine. So these enveloped viruses are very, very susceptible and they can be easily killed. Then bacteria, then comes your mycobacteria, which is relatively resistant as comparison to your vegetative bacteria. Your fungi are much more resistant. Then comes your non-enveloped viruses and spores. Spores are most resistant. So by sterilization, we want to kill spores as well because the devices they are going to enter into the blood, into the sterile tissue. So we want that a sterile device doesn't have spores as well. So when we are talking about high level disinfectants, then it will be taking care of some of the spores, but all the spores will not be killed. Intermediate level of disinfectants, they will not take care of spores. They will kill some of the non-enveloped viruses and your fungi, but your mycobacteria, bacteria, viruses will be killed. And very low level of disinfectant like those which we use on surfaces, on floor, they just kill only enveloped viruses and bacteria. So this is very important chart which gives you an overview of the entire sterilization and disinfection lecture. Then there was this surgeon called Spaulding. He made the life very, very easy. He divided the instruments into three broad groups to understand whether we need sterilization or whether we need disinfection. If disinfection is needed, what type of disinfection is needed. So, according to him, those instruments which enter into the tissues or the bloodstream, all of you know, these are sterile sites. So whatever instrument is entering into the bloodstream during surgery, they have to be totally sterile. They should not be having any type of microorganism and even spores should not be present there. But if any of the devices is entering into your mucous membranes, like your endoscopes, they are coming in contact with the mucous membrane or your skin, which is abraded or it is not intact, then you need high level of disinfection. Means you need less number of microorganisms, but still some of the spores may be present, but we need still good quality, little less than the sterilization. Why so? Just this is a simple principle. As you know, our GIT is not sterile. The acidity in our stomach can take care of some of the microorganisms which enter through the endoscopes. So the sites which are not sterile, we eat food, it is also not sterile. So we need high level disinfection for those instruments which are coming in contact with the mucous membranes. For example, your GI endoscope when it is going inside. There are certain instruments which are just coming in contact with the intact skin. For example, your sphygmomanometer, BP cuff, it is coming to contact with the intact skin. Your bed pans, thermometers, they need disinfection, but they do not need such critical level of disinfection. Even if some bacteria are present, they will be taken care of by the normal barriers of the host. So this is a broad classification which helps you in understanding which type of instrument has to undergo sterilization and disinfection. Now, efficacy of any sterilization or disinfection techniques depend upon some factors. The most important factor is cleaning of the object. One take-home message from today's lecture is cleaning is prerequisite for any sterilization and disinfection. If you directly put any instrument into your autoclave, you will not achieve sterilization even if everything is working fine. The instrument has to be clean. Cleaning in itself reduces 3 log reduction in the number of bacteria. Imagine 1000 bacteria per square meter area are taken care of just by the cleaning. So cleaning is removal of organic matter, your soil, your inorganic matter, and without cleaning, neither the sterilization will work nor disinfection is work. So cleaning becomes the most important step. that organic and the inorganic load present. If you have not done proper cleaning and there is lot of organic matter, your sterilant will not be able to penetrate, will not be able to kill the microorganisms. Then what type of microbial contamination is present, whether spores are present, it will also decide the efficacy of sterilization and disinfection. There are certain devices which are very, very long. If there is a catheter, there is a tubing which is very long. Your sterilant, your gas cannot penetrate through the long tubings. So it also matters what is the type of the material you are using for sterilization. I hope some of you are first year PGs. You understand what are biofilms. Biofilms are the aggregate of bacteria which are present very much adhered to certain surfaces. So if there are biofilms, it will be difficult for the sterilizers or the disinfectant to reach the innermost layer of the microorganisms. So we need certain enzymatic things which can disperse these biofilms. Then concentration and exposure time to disinfectant and sterilant is very, very important, which I will again discuss. Nature of the object. What is the quality of the object? How much endurance it has to a particular sterilant and disinfection? What is the temperature? What is the relative humidity which you are using? So when we look at the workflow in the sterilization cycle or in any CSSD, it starts with cleaning, then comes drying, then comes inspection and assembly, packaging, labeling, sterilization, quality assurance, storage and distribution. So today I will be just showing you little bit about this workflow in sterilization cycle. Everything starts in the operation theater. In the lab also, whenever you are looking at these culture plates, first of all, these culture plates are cleaned. So cleaning becomes a very, very important step. Pre-cleaning starts from the operation theater itself. Imagine if a surgeon while operating leave all the instrument like this. Imagine how much the blood will be dried on these instruments and how difficult will it be for the CSSD person to remove this dried blood. In kitchen also, your mama always tells you to please put some water on the utensils. If these get dried, it becomes very difficult for the maid to come and clean, and she will always be saying, what is this? So in operation theater also, nurses are advised to keep the instruments inside a soaked gauze, soaked linen, or they can put some enzymatic cleaner or some foam so that there is wetness is there and everything is not getting deposited. And this has to start from the operation theater only. After operation theater, after the pre-cleaning of the instrument, these instruments are sent to CSSD. Operation theater is a sterile area. In that, you should not be doing unnecessarily cleaning. The cleaning should be reserved to CSSD, but yes, pre-cleaning should be done in the operation theater itself. For the cleaning, items must be cleaned using water with detergent or with enzymatic cleaner before processing. Sometimes we do manual cleaning. In certain CSSDs, we have mechanical cleaners. We have certain machines like we have ultrasonic cleaners, washer disinfectors or sterilization, which we generally put our instrument and by agitation, they clean the instrument from the dirt, from the soil. Whenever you are doing, understand these principles because you will be going as a quality implementer to CSSD. Whenever manual cleaning is done, they do inside a sink which is filled with water. It is never done with the running water because when you are doing cleaning with the running water, there will be aerosolization of these bacteria and these can infect you. So you do this cleaning with the submerged water. Water is there and your instruments are submerged inside this tank or sink. And mechanical cleaners, we have ultrasonic cleaner. There is a defined cycle. The manufacturer tells you what should be the time of contact, how to put the load, how water quality is also very, very important because most of the sterilizer processes depend upon water quality. If water is not good, it will cause the corrosion of your instrument. It will leave some stains and the life of these instruments like ultrasonic cleaners, etc., also deteriorates. Fine. So this is how cleaning has to be done properly and it should remove all the residual matter. When you have these long devices, your endoscopic machines, if you just don't do proper cleaning, your sterilization or disinfection will not be achieved. Cleaning is very, very important. Our teachers used to tell us cleaning is the most important step wherever you are going, whether you are talking about your instruments, your laboratory thing, your environmental procedures. If you keep on applying disinfectants on your surfaces, on your floors, it will not be effective, and cleaning has to be very, very proper. After cleaning, you have to check your instruments whether they have been appropriately cleaned or not cleaned. In the CSSD, they use a magnifying glass to check for the cleaning. There are some other machines available like ATP bioluminescence by 3M, by which they check the quality of the cleaning. Then how they are laid in the sterilization tray, which will be put inside a autoclave or any other machine. So arrangement has to be according to the surgical list, the order of the use. The items should be laid so that whatever sterilant you are using, if you are using steam, it should be able to come in contact with each and every part of that instrument. And those instruments you must have seen as an intern, as a house job. Whenever you open a tray, the instruments which can be opened or which have a hinge, they are opened up so that steam can enter into these hinges. Heavy items are always positioned down and there should be no overloading. We always say that it should be a single layer because your sterilant has to penetrate each and every part so that all the microbes present are killed. After assembly, you have understood this, you have received items in your CSSD. First of all, you are cleaning, then you are inspecting whether they are working properly, whether they are actually clean, there is no blood spot. After that, you lay down in your sterilization tray in a proper way according to the type of the surgery, according to the usage. Sometimes you know that this instrument will be required prior to the next instrument. Then the packaging. You have to wrap this sterile tray in different material. It will also depend what type of material you are going to use, what type of sterilizers you are using. Are you using a ethylene oxide or you are using an autoclave? There are different materials available to wrap these items. As if you have observed during your internship, you must have seen a instrument tray is wrapped in the double layer. Why double layer? The outer layer becomes contaminated when it is being transported, when it is being stored, but the inside layer is sterile. So the outside layer is opened up by the nurse and the inside layer, it is opened in the sterile field by the surgeon, which is sterile. So there are sequential wrap. We are using the true two layers of the linen to wrap an item. Fine. After packaging, you have to identify what is the load inside, whether it is a surgical tray for some procedure, whether it is a cholecystectomy tray, whether it is a tray for cultocentesis, whatever is the procedure. So the labeling is very, very important. The labeling should have certain important things. You must have seen. If you have not seen, I will request you to please go to your central sterile department or go to the OT. Just see these sterile packs, how they look like. You must have seen that there is some tape which is present on the outside of this sterile tray. Please go and find out, go and see. This sterile tray is autoclave tape. If you have not seen this, go and check wherever your media is being prepared in your microbiology lab. They are always putting this autoclave tape to find out the efficacy, which I will be telling you later. So labeling is very important. There should be initial of the person who is actually putting this sterilizer, what is the number of the sterilizer, because in CSSD there can be 10 autoclaves. What is the batch number? What does the pack contain? This is a type 1 indicator. You can put it separately or sometimes it come as a label. These labels can be of various form. They can come pre-printed from the market. Sometimes some hospitals have a stamp which should not be washable when it goes inside the autoclave. Some people are using these marker pens to label it. So it can be different type of labeling, but the labeling should be traceable. If there is any surgical site infection, you should be knowing which load was released from which autoclave. So labeling becomes a very, very important part of your this. Then after this, you have labeled it, you have to put inside a sterilizer. Sterilization techniques can be different type of sterilization technique. There can be certain physical methods of sterilization like your autoclave. All of you have seen your autoclave in microbiology laboratory. There are larger autoclaves in your CSSD, much larger, different type of designs, horizontal, some are wall mounted, big ones. And dry heat. You must have seen the hot air oven, which we generally use to dry our petri dishes. If you have not seen, go and check it out in your microbiology lab. All of us have that hot air oven. Beside these physical methods, we also have certain chemical methods of sterilization. Then this is a very important question for postgraduates to understand. Some of the postgraduates think that chemicals are used for disinfectants. No, there are many chemicals which are used as the sterilants, and these chemicals, they come in machine form. There are ethylene oxide machine, hydrogen peroxide or gas plasma, low temperature steam formaldehyde, ozone. We have certain liquid chemicals also, which we are using at a sterilant. So you can get a question on the chemical sterilant. So please understand there are many chemicals which are used in machine form for sterilization or as a liquid form. So let's discuss one by one. In the physical methods, first of all, I will tell you the autoclave, and you all should be knowing everything about autoclave because it is the most simple type of sterilizer available in every facility, be it a primary health center, be it a tertiary care center. And it is very cheap, it is very safe, very economical, and really useful. This autoclave, it basically works on the principle of the pressure cooker. In this, we are using steam, which has very high latent heat to kill the microorganism by coagulation and denaturation of proteins and enzymes. As you all have seen that we use pressure cooker to cook the food if we want to save our time. Water generally boils when its boiling point becomes equal to the atmospheric pressure. So normally the water will boil at 100 degrees centigrade. But if you put up pressure or if you put that CT, what you call that? You put up weight on the pressure cooker, then water boils at a higher temperature, and so the steam which is generated, it has much more latent energy and the water is cooked very quickly. So similar is the principle of autoclave. In autoclave, we put an external pressure so that the water boils at a much higher temperature. If we give a 15 pound pressure per square inch, then the water boils at 121 degrees centigrade. So all this latent heat is present in the steam when it will come in contact with the cold equipments, cold instruments. It will transfer its heat to these microorganisms and these microorganisms will be killed. This autoclave is very simple method, but as students, you must remember the time, temperature, and pressure. Generally, you should remember one temperature at least. It is 121 degrees centigrade for 15 minutes at 15 pound pressure per square inch. This is for unpacked items like we are using in our laboratory. You are sterilizing a media. You do not put it in the linen. You just put it in a flask and then put inside the autoclave. But when you are wrapping it in the layer of the cloths like we do in our CSSD, we have to increase the temperature to 30 minutes. One very important message, this time of 15 minutes is after the autoclave has reached a temperature of 121 degrees centigrade. If you increase the temperature further or increase the pressure, your time will decrease. One important thing which you should remember, autoclave is not used for the items like which are heat labile. Your because it is a very high temperature of 121, which we will be seeing your endoscopes. They cannot be sterilized. Your rubber material, your plastics, because they will get spoiled at 121 degrees centigrade. Similarly, sometimes you use paraffin wax. When you are using certain biochemical tests, you have to put waxes. Your oils, waxes, powders cannot be sterilized by autoclave because steam cannot penetrate oil, waxes, and powder. For these, you have to use hot air oven. So this is again a very important message. Autoclaves are of different type. Most of us have a gravity displacement type of the autoclave in the laboratory. But in CSSDs, which have very good type of instrument, they have vacuum type. What is the basic difference? In gravity displacement type, you are introducing steam from above and your air is removed by gravity. So there is complete removal of air. We are not bothered while air is removed because it is being removed by the air, and there is no air left in the gravity type of the autoclave. The only thing is it takes some time, at least 15 minutes to 45 minutes. But if it is a very high throughput hospital, we are having high vacuum type of the sterilizer. In this, we first of all remove the air by vacuum. So it is very, very time saving. You are quickly removing the air by vacuum and there is immediate generation of the steam and the time is saved. Faster, better penetration is there. But because you are removing air by vacuum, if you are putting any liquid in the labs, it will just blow out. So in laboratory, we generally use gravity type of displacement of autoclaves, gravity type of autoclaves, because we have these media. They will all be blasted out. And high vacuum type are not suitable for liquids, but they are very, very useful for the hospitals which have very high load. Autoclave advantages, they are very easily available, cost effective, non-toxic, very good penetration of steam, and a very high amount of energy which can be transferred to the microorganisms for their killing. They can be used for all the instruments which are not heat sensitive or moisture sensitive because we are using this steam to sterilize. Water quality is important. There can be corrosion because of this steam. Heat sensitive items will be damaged. And sometimes when you are just removing the items from the autoclave, the packages can be damp. If the packages are damp, they're just little lightly wet, then it is okay. But actually, if they are very damp, it means the autoclave, the steam is not dry. We need very, very dry steam. We do not need any air water mixture. The load which is coming out of the autoclave should never be wet. Light dampness is allowed, but it should not be wet. Otherwise, there is some problem with the autoclave functioning. And there is always a risk of burn if the entire pressure is not released before opening the autoclave. Is it clear till now? Then there is one special type of autoclave. Please go and find out in your operation theaters. I still remember many hospitals, they have this tabletop sterilizer, which is also called as the flash sterilizer. It is a mini autoclave type of the thing, which is put inside the OT. While operating, if some instrument falls on the floor, or there is some very sharp instrument you need it urgently for the operation, they just use this rapid steam sterilizer. The time taken is only 3 to 10 minutes at 134 degrees centigrade. So in this, we do not pack the instrument. We cannot sterilize it and store it for later. It is used just for the immediate use. Something has fallen or there was something which was missing in the tray. It has to be taken out from some other OT table. In that case, this is used. This is just an emergency situation, not to be used for implants, your cannulated instruments, because the exposure is not very good. And please understand, flash sterilizer is not a reason for convenience. Just use it there only because there is no monitoring method to check its efficacy. This is only an emergency sterilizer to be used only in rare circumstances, not as a routine. You get a short note on fresh sterilization, so it is important again. So for steam sterilization, there are certain important things. The proper loading must occur. Why? Your steam should penetrate inside your tray. If you have made this tray very tight, the steam will not penetrate. Similarly, when you are putting, suppose you are making manually the blood culture bottles. If you have closed them very, very tightly, the steam will not penetrate. So we always leave one, that grooves are there, na? We just leave one groove little loose. And after autoclaving, we make it tight. Otherwise, steam will not penetrate and it will not bring about the sterility. And all the items in the load must be placed correctly and loosely. All the instruments which have hinges, they should be opened up because we want that steam to come in contact with each and every surface of the instrument. Items in the load must be free from grease and oil. I already told you because steam cannot penetrate grease and oil. Air in the sterilizer and load must be removed fully, otherwise it will lead to the steam air mixture and it will not bring about the proper sterilization. Time and temperature are very, very important. Then we have these hot air ovens in our laboratories. And as microbiology students, you will be asked about the temperature. You have to remember this temperature: 160 degrees centigrade for 2 hours, 170 degrees centigrade for 1 hour. Generally, we are using it for powders, oils, grease, petroleum products, our glass petri dishes in the labs, and sharp instrument, because sometimes these sharp instruments get corroded and their sharpness is reduced by repeated autoclaving. There are different type of hot air oven available. I'm not going into detail, and the temperatures are also different. But as microbiology students, you cannot afford to forget 160 degrees centigrade for 2 hours. This is an important take-home message, and they bring about the killing of microorganisms by oxidation. This is the important thing. So we have discussed autoclave and hot air oven. They are requiring high temperature. There is always a chance of burns. Then there are certain methods in which cold sterilization. Cold doesn't mean that we are using some cold method. It is relative to the autoclave and hot air oven. We have less temperature than autoclave and hot air oven. 55 degree, 60 degree is nearly the temperature. So there are different type of machines: your ethylene oxide, hydrogen peroxide, low temperature steam formaldehyde, ozone, which we will be just looking at. Remember, you get a short note on cold sterilization. So when you are talking about cold sterilization, you have to talk about these machines, as well as you have to talk about liquid sterilants, because in that you are also not increasing the temperature, which I will be showing you in a slide. One take home message which I want to give you: these are important for heat sensitive devices, your catheters, your endoscopes, moisture sensitive material, complex instruments, electronics, your catheters, resuscitation bags, anesthesia mask, fiber optic instruments, heart lung machine, electrical devices, laparoscopic equipment, sharps, because sharpness is destroyed by autoclave because of steam. So again and again, when I'm talking about these instruments, the principle remains same. All of these instruments can be used for heat sensitive and moisture sensitive. I will not again tell you which item is to be sterilized by ETO or hydrogen peroxide. I will be just tell you the important differences in those which you should know. What is ethylene oxide sterilization? This is available in most of the hospital. The only disadvantage, first of all, I will be telling you the advantage. Ethylene oxide is a colorless, odorless gas, but it is very, very flammable and toxic. So the two disadvantages are flammable and toxic. It is a very toxic gas. And current ETO sterilizers are using 10 to 20% ETO mixed with hydrochlorofluorocarbons or carbon dioxide. It brings about the killing of microorganisms by alkylation. So as I told you, it is a cold sterilization. Contact time of 4 to 5 hours is required at 38 degrees centigrade and 1 hour is required at 55 degrees centigrade. Again, please, one very important thing: ETO is a very, very toxic gas. So it just penetrates, but we have to remove this ETO by aeration, by purging in air into the machine. And aeration takes about 8 to 12 hours depending upon conditions. There are some machines which have less hours of aeration required. So you can see, although it is a cold sterilizer, but the aeration time is very, very long. Overnight you have to leave. So you cannot process too much of the load in ETO. You have to aerate the pack before taking it for use, because this is a very, very toxic gas. You can use any type of packaging material because ETO penetrates very well. So the most important thing you have to remember about ETO: this is a toxic gas. ETO, T indicates it is a toxic gas, but it has an excellent penetration. It can penetrate easily, very good penetration capacity. It works with almost all materials and very good, very good. The only disadvantage: First of all, this is a very toxic gas. I told you, this is an expensive system. If you are using certain instruments, certain catheters, you have to always do a cost benefit analysis whether you should buy a new instrument rather than sterilize it. You have to look at your workload. ETO is a toxic gas, turnaround time is very, very long, expensive. Cartridges which are used for ETO generation are very costly. It is a carcinogen, so you have to understand where we can use it and we have to do this cost benefit analysis. Then your gas plasma. Please try to remember one thing, gas plasma. So it is an ionized gas which is generated from hydrogen peroxide. Hydrogen peroxide is passed under deep vacuum, and these radio frequency waves in the electrical field, they generate this gas plasma. One important thing to remember, uses are same. They are all used for those delicate items which are heat sensitive and moisture sensitive. It is a fast method. Unlike ETO, which was requiring an overnight, your load is ready for use for 25 to 75 minutes within 1 hour. याद रखने के लिए 1 घंटे में रेडी हो जाता है. कोल्ड स्टेरिलाइजेशन है बिकॉज टेम्परेचर इज जस्ट नॉट राइजिंग टू मच, 40 डिग्री सेंटीग्रेड. One very good thing, you do not need to aerate it. Non-toxic byproducts, it is not toxic as ETO, but problem is it has poor penetration. ETO had very good penetration, so it is not good for long or narrow lumens. If it is a small device or a long device, you cannot use it. It requires synthetic packaging like polypropylene wraps, polyolefin pouches, and it cannot be used with cellulose, liquids, powders. Again, it is expensive and toxic at the level of, it is also toxic, but the byproducts which are produced. So it is not as good as ETO for penetration, but time is less and it is not toxic very much. Low temperature steam formaldehyde, as the name indicates, in this formaldehyde or formalin, it is vaporized into a formaldehyde gas and is admitted in the sterilizer chamber. So basically you are using formaldehyde gas. Have you ever smelled formaldehyde? When you used to go in your anatomy lectures, that formalin smell, you used to weep like anything. Similarly, in pathology, they keep their tissues. So formaldehyde is again very, very toxic. Carcinogen is there. The use of formaldehyde is decreasing. It has better penetration than gas plasma. It is cheaper than ETO, but again, there is a problem of this toxicity and carcinogenicity. Temperature is okay, it is cold, 70 to 75 degrees centigrade, and cycle is also relatively longer than gas plasma. It is less than ETO, but it is still longer. But nowadays, people are not using formaldehyde because of this carcinogenic potential it has. Then this is the ozone. As the name indicate that ozone is generated using oxygen along with water and electricity. So it sounds to be safe, and many heat sensitive FDA cleared instruments are available in market. Sterilization cycle is 4.5 hours. It is slower than plasma. So you can see among all of these, fastest cycle was with gas plasma. Temperature is cold sterilization, 30, 35, 40 degrees centigrade. No hazardous chemical storage required because it is generated from oxygen and water. Half-life is 22 minutes at room temperature. It is compatible with stainless steel, titanium, aluminium, etc. But penetration is very poor. It corrodes metals, brass, copper, carbon, steel. It degrades rubber, latex, some plastics. It is incompatible with paper, linen, wrap. So it is actually, although non-toxic, no toxic residue, impractical to use when the penetration is not there. And most of the devices I told you, they are long. So among all of these, ETO seems as the most practical thing, but it is toxic. So some people call filtration as a method of sterilization, but it is actually not. It is just a method of reducing the number of the particles. Like you have seen, we are using surgical masks. In your operation theaters, you have these HEPA filters. They reduce the number of microorganisms which are falling onto the OT table. In dialysis water, we are using certain filtration techniques. So, and in laboratory also, you people use filtration for heat labile fluids. Radiation is also a low temperature sterilization technique. We have ionizing radiations and non-ionizing, cobalt 60 gamma radiation or electron accelerators. You must have seen, if you have not seen, please go and see those syringes which are available. Just read the wrapper, you will find it is written that sterilized by using gamma radiation. It is used in industries, not in hospital. These gamma radiation have high penetrating power and very good for manufacturers, for big industries. Ultraviolet rays, these are surface disinfectants. They cannot penetrate at all. Some of the hospitals where TB patients are there, or also in certain laboratory setups, like in your PCR lab, we have got these ultraviolet lights. They cannot be switched on when some people are working because they emit these are carcinogenic, but they can bring about only surface level of disinfection. Only surfaces microorganisms can be killed. They cannot penetrate inside the surfaces. So I hope you have understood the different type of sterilants. There are certain chemicals also in which we can dip our instrument for a certain time period. Please understand, most of the sterilants, these liquid sterilants, liquid chemicals, they are high level disinfectants or disinfectant. But when we increase the contact time, they can become as chemical sterilant. So your glutaraldehyde, hydrogen peroxide, peracetic acid, they can be used as high level disinfectant or as a chemical sterilant based on the contact time. In between the patients, what do the doctors do when they are using the endoscope? When they are going to use it from one patient to another patient, they leave it immersed in glutaraldehyde for 20 to 30 minutes. It just brings about the high level of disinfection. But after the endoscopy has been performed for the entire day, they leave the endoscope immersed in glutaraldehyde for overnight for 10 hours. Then it brings about the sterilant, if it is able to penetrate. If your sterilant has not entered into the channels of the endoscope, it will not bring about the activity. So contact time is very important. A same chemical can work as a sterilant or as a high level disinfectant depending upon the concentration used, contact time, temperature and pH. Okay. Now, very, very important part of today's lecture is sterilization process monitoring. We always speak about quality assurance in microbiology. In everything you will be listening, whether it is your bacteriology, whether it is your CSSD, everywhere we talk about quality assurance and how to bring about the quality assurance in sterilization. There are different type of process. There are physical indicators, chemical indicators, biological indicators to look for the sterility. So what do you mean by the mechanical indicators? These are physical indicators. They basically tell you, yes, your machine is working. Your autoclave is achieving a particular temperature. The pressure is correct. The time of contact is proper. If it is your ETO sterilizer, gas concentration is proper. So they are just telling you about your equipment. Yes, your instrument is working fine. Your sterilizer is okay. So these mechanical indicators, you may be having any type of the gauge attached. These are anything can be there. Some of these autoclaves, they give a printout. Recorder is there, microprocessor. Sometimes you just look at the gauge and you say, yes, yes, temperature is fine, time of exposure is fine. But understand, these physical indicators are very, very good. They are required. We have to make a logbook wherever you are using a sterilizer, whether it in the laboratory or in the CSSD. You have to have a logbook which mentions time, temperature, pressure, autoclave number. So these indicators are important, but they do not tell you whether your load is sterile or not. Suppose a technician was going to process 100 trays. He has just forgotten 10 trays to put inside the autoclave. Although your autoclave was working, but still your instruments are not sterile. So these physical indicators, they tell you, yes, your instrument is working, but they are not telling you whether your instrument is sterile or not, or tray is sterile or not. Okay. So for that, we need chemical indicators. What are these chemical indicators? I just gave you an example, autoclave tape. If you have not seen, please go and ask your technician who is working in this media room. Show you this chemical tape. Autoclave tape is available everywhere. In every unit it is available. So this chemical indicator, it tells you about, there are different type of the chemical indicator. They give you different purpose. They are exposure control, they are pack control, air removal test, different. These chemical indicators, these are basically strips which will change color on exposure to a particular temperature or a particular time. These can be external or internal, and they monitor time, temperature, sterility, and they give immediate results. There is a color change, so you can say yes. And color change will depend upon the manufacturer. They will tell you that the color should change from this to this. So as this is a autoclave test, this is autoclave tape test, or the this is easily available. This is before exposure to autoclave, the color, there is no darkening of these stripes, but when after exposure these stripes change color. So class 1 type of the chemical indicator is also called as the process indicator or the external indicator. One thing very important I want to tell you, these autoclave tape are to be put on the outside of our load. If it is a drum which is going inside the autoclave, they have to be put on the outside. They should never be put inside. They cannot be put inside a tray. They have to be put outside. So they are also called as the external indicators. They just tell you, yes, your tray has been exposed to steam. It only distinguishes processed from unprocessed medical device, because it doesn't tell you whether the steam has entered inside the tray. It just tell you, yes, this load has gone inside the autoclave. But whether the load was properly cleaned or not, whether it was properly packed or not, whether the steam entered actually inside the load, it will not tell you. Suppose you have made a very tight packing with no perforations in the tray, no space for the steam to enter, then your load, your instruments will be unsterile. It is always applied outside, and it just tells you, yes, it has been exposed to some temperature, exposed to steam. Sometimes it is used to secure or label the packs. As I showed you in the labeling, we have this chemical indicator. This different type of autoclave tape, dots, pouches, etc. are available. You should always check before color change, because it should not have changed color before using. Then there are chemical indicator class 2. You have to remember this. This is a very important thing, and you will get a short note on the quality assurance in sterilization. This is a very important favorite question. So class 2, what are class 2? Please understand, class 2 indicators we are using to check for the complete air removal. As I told you, in gravity type of autoclave, there is no problem. Air will be removed by gravity. So we do not need these class 2 indicators in the gravity type of autoclave. But we need this in the pre-vacuum type of the sterilizer, in which we are removing air by vacuum. We want to check whether air has been completely removed or not. So this Bowie tape test, or the class 2 indicator, it is used daily before the first load is processed, and it has to be kept in an empty autoclave. The first autoclave has to run empty with only with the Bowie tape test to look whether this is functioning fine or not. Again, it is not telling you about sterilization. It is just telling you, yes, air is being removed completely. So you understand? Type 1 indicator is just telling you, yes, your load has gone inside the autoclave. Class 2 indicator is just telling you, yes, your pre-vacuum type of the sterilizer is working fine as air has been completely removed. It is also not telling you whether the item which our surgeon is going to use is sterile or not. Clear? Then we have, these are certain pictures. They come in different size, different shapes, and you have to always look for before and after color change. It is always given on the box that yes, this color will be changed to this. So these are Bovitic tape tests. How do we put Bovitic? One important key message: put first of all the first cycle. Every day it is put when the autoclave is empty. You put it near the drain inside a challenge pack. This is called a pack. There are certain towel, their thickness is determined in center. You put this bovidic tape and you put it inside a autoclave and run it in an empty sterilizer. So this is called a process challenge device, which I showed you. In this, it helps how to put it. You cannot keep this bovidic tape test like this on the drain. You have to pack it because you have to check for the in the complete load. Okay. Then beside this class 1 autoclave tape, class 2 is Bovidic, class 3, class 4, class 5, class 6. They are increasing generation of the chemical indicators. They are placed inside a pack, inside a sterile tray, and then we look for change. As you can understand, class 3 is single. It will just tell you about time, temperature or humidity. Class 4 tells about change in time, temperature, time, pressure, only two variable. Most of the hospitals, they use class 5 indicator. When a surgeon opens the tray, first of all, he will look at this indicator. By a sterile forceps, he will remove it and they are placed on the patient file. Yes, this is working. We have quality assured the sterile tray. Class 5 indicators are integrating indicator. They tell you about time, temperature and pressure, and they have very good correlation with biological indicators, which I will be telling you. And class 6 are much more advanced. They are emulating indicator. They tell you the entire time. If you are using it for 30 minutes autoclave, throughout 30 minute time, temperature and pressure were okay. So they are little advanced and these are internal kept inside. Again, quickly telling you, class 1 indicator autoclave tape, put outside a load. Class 2, they tell about your equipment functioning, air removal is or there or not. Class 3, 4, 5, 6, they are put inside the sterile tray, which you have to check when you are opening it before surgery. These are different type of tapes available. They come in different size, different companies, not going into detail. Then one more type of indicator is biological indicator. As the name indicates, if a autoclave is working fine, they should be able to bring in at least 6 log reduction in the number of spores as well. The spores should be killed because spores are most resistant of all the microbiological forms. Different names are there for different type of spores and different type of the machines. And so these are the most reliable method of monitoring the sterilization because we want to get rid of the spores. Okay. So again, these biological indicators, they tell you about the load control. Suppose you have done everything, your packaging, etc., everything is fine, but you have put so many items inside the autoclave, your steam is not able to penetrate. So biological indicators also tell you about the load control. They ideally should be used every day, but it is practically very difficult because this incurs a cost as well as you have to culture this spores which takes certain time. It will take 48 to 72 hours. So the results are available only after 72 hours. So most of the hospitals, they are using the biological indicator at a frequency of 7 days or 15 days. But if you use for 1 month, they don't solve any purpose. So biological indicators, ideally they should be used daily, but at least we should be using them weekly. As you can see, again, there is a challenge test pack. We put it near the drain. In the center, we have put these spores. And these spores should be killed if your autoclave is working fine. So after running in the loaded, as you can see, this is not an empty sterilizer. These biological indicators are run in a fully loaded sterilizer. Bovidic is put in an empty sterilizer. Is it clear? So you remove it, you culture them, they should not grow, and you should always have a control biological indicator which you should grow. If your control is also not growing, it means your media is not working in the lab or there is some other problem. So I'm not going into this. There are some rapid methods also which just gives you a color change. These are available in the CSSD itself. After this, they can check for it. You have done every possible good thing. You have quality assured. But if you do not store your sterilized item properly, well labeled in a clean place with a clear filters, positive pressure ventilation, temperature, humidity, everything is very, very important. In CSSD, storage of sterilized items become very important. And then how they are transported outside the CSSD to the main OT. What is the shelf life? For how long duration can you use these sterilized items? So, shelf life nowadays, I don't know if you remember when we long back, we always used to say, yes, this sterile load can be used only for 3 days. After this, we have to re-sterile. Nowadays, there is a concept of event related and time related shelf life. Nowadays, people, especially in developed countries, they have moved toward the event related shelf life. They say if you have taken all the precautions, you have done proper packaging, you have done all quality indicator, the load once the item once sterilized is sterilized till that time some event has occurred. So sterility of item will depend upon quality of packaging material. If you have stored it properly, positive pressure ventilation is there, transport is good, handling is minimum. So, event related shelf life is a newer concept. In this, they say that the product should remain sterile until it has fallen on ground. There are certain tears, there are some parasite infestation, there is some fungus in the storage area. So a pack is sterile unless opened or damaged. Now, I cannot say whether you will be following time related or event related. This you have to decide when you come in field, when you are actually looking in the hospital. You have to clearly write in your policies which you make, which you will be learning later on. So there are both the concepts are there. Traditional is we say that the linen 7 days we can use. If there is a pack which is covered with linen, we can use it for 7 days. After 7 days, you have to re-sterile. Different hospitals follow different things. Okay, but concept is important because you may get a short note on event related shelf life as well. So transportation is also important. You cannot use the same carts which were used to transport the dirty things into the CSSD. Either these carts are getting disinfected by passing through a ultraviolet radiation or thermal disinfection, or you are using separate carts for transporting the sterile supplies. So just a brief overview of the CSSD layout. CSSD, as we talk about in OT, there has to be a clear-cut zoning. We divide the CSSD properly. It is just an sterile area as is OT. There is an area where we receive these dirty items, we clean it. There is a sterilization area, there is a storage area, there is a delivery area, there is a unidirectional flow. A thing which is coming in one direction has to move and it has to go out. Again, I'm not talking about environmental parameters and other things. Just briefly, I will be telling you in 5-7 minutes about disinfection. So disinfection you have understood. For disinfection, we use chemicals. Disinfection is used for heat sensitive equipments. Otherwise, we would have loved to autoclave everything. Autoclave is excellent. If anything which can be autoclaved, do autoclaving. Concentration of the chemicals you are using, the time of immersion, the pH, temperature, bioburden are very, very important determinants of the efficacy of disinfection. As I told you, cleaning. You cannot forget cleaning for anything. Cleaning with soap water, cleaning with enzymes water is very, very important before sterilization or disinfection. Chemical advantages, it is economy. You have to just dip an item into a chemical. Speed, simplicity. You cannot wrap this item and can store. You cannot do that. As for sterile supplies, you can keep them for 7 days. You can keep them for 1 month. But these chemicals, they have to be used there and then. The instrument which you have dipped in a chemical, it has been removed. It has to be used there and then. These chemicals, residues which can be present on these equipments or instruments can be toxic to skin, respiratory mucosa. So this is also a problem. So we discussed some disinfectants in the earlier slide where I showed you the same disinfectants were there. This was the same slide which was there. The only difference there, the contact time and temperature were different. So if a glutaraldehyde 2% is used for 10-hour contact time, it becomes a sterilant. But if it is used for 20 to 90 minutes, it becomes a high level disinfectant, which will not kill all the spores, but will reduce it significantly. So these are different type of the chemicals. Time, temperature is important. So they are used for semi-critical items, those who are coming in contact with the mucous membrane. Ozone is also a very good disinfectant, and there is no residual effect. It is non-toxic. As we talked about those machines ozones in which we are putting certain items, ozonizers are also placed in the hospital, and the water which is coming out, it is used for surface disinfectant. It is effective against bacteria, viruses, pores, biofilm. Real-time generation is there. Person will come, collect it and use it. It decomposes to oxygen, and there is no residual effect. Residual effect means when a chemical is placed, it should have a residual effect so that it is bringing its action. You have to repeatedly clean the surfaces as there is no residual action. Ozone decomposes rapidly. And as I told you earlier also, soft rubber, etc. get this. So ozone is generally used for surface cleaning in the hospitals. Okay. It is superior to hydrogen peroxide against MDR bacteria. Many are times in hospitals for drain decontamination, because in drains there are biofilms. So ozone is just flushed into it and it brings about a drastic reduction in the number of bacteria. In dialysis, water treatment, ozone is being used. In pharmaceutical companies, they are using, and food treatment, ozone is being used. So this brings me towards the non-critical items, intermediate to low-level disinfection, like your boiling, ethyl alcohol, chlorine, your sodium hypochlorite, your phenols, your quaternary ammonium compounds. They are intermediate or low level disinfectants. They are used on surfaces, your floors, your furniture, but you have to see whether they are compatible with that particular. As you know, sodium hypochlorite should not be used on granite, on your stainless steel, because it deteriorates these things. So you have to decide which chemical it should be compatible with the surface. So contact time also becomes very, very important for this. There is this super oxidized water. In many hospitals, this machine is there. So it is just using salt and electricity, and hypochlorous acid is being produced. It is a potent oxidizer but safe to touch. It is used for wound care, cleaning, debriding, moistening, for diabetic foots, burns, for endoscope cleaning, for surfaces, and it is also not a sterilant, just a disinfectant. So, how to use disinfectants? As I told you, you should have a clear-cut lead policy. Every disinfectant, the time, the contact time, the pH, how to dilute it should be clearly written, and your staff should be aware of that. So you need to develop a policy. Disinfectant may be supplied ready to use by the manufacturer, or you have to dilute them. You have to dilute them based on the manufacturer instruction. You just cannot use your own whims and fancies. Even these common things, like you are giving your cleaning staff this phenols, you are giving them, they are just diluting it depending upon the availability. No, you have to tell them how much phenyl is to be taken, how much water is to be taken. Dilutions are to be made with clean water. You should avoid wastage. You have to dilute that much which is required, because you cannot store these diluted chemicals for long. Never mix up freshly made diluted solution with the old solution, and wash and dry the container whenever you are making a new solution. After disinfection, we should always throw that water and clean it. If you are using alcoholic solutions, you have to allow them to dry. We also say, like I always say, whenever you are doing skin antisepsis by using isopropyl alcohol. I have seen phlebotomies, they just use isopropyl alcohol. Before it has dried up, they just inject their needle. So it will not bring about the antisepsis. First of all, let the alcohol dry, because only then the organisms will be killed. Otherwise, it will not bring about its action. All the devices, they should be cleaned with sterile water, filtered water, or tap water before putting inside the mucous membrane, because these chemicals can be allergenic. Like quality assurance in sterilization, we also need the quality assurance in disinfectants. So why do we need quality assurance? First of all, whatever product you are buying from the market, you need to know the potency and efficacy, because manufacturers make tall claims. They say, yes, our product is very, very good. So you may need to check their potency before buying, because you are going to buy so many bottles, whether it is effective or not. Sometimes you do not want to evaluate the concentration, but actually when you are using in your lab, using in your hospital, you want to look whether it is actually working in your hospital or not. So there are different methods of doing disinfectant efficacy testing. In earlier times when we were students, we used to do phenol coefficient and Chick Martin. That was also done as a laboratory exercise. Now it has become historical, but we are still using calci-Sykes test whenever we are buying a new product. If we want to check the efficacy before buying it, we can do the calci-Sykes test, in which we challenge it with different type of microorganisms. And then when we are actually using the chemical, suppose you are using any chemical for disinfection, you are using your phenol for mycobacteria slides or mycobacteria sputum containers, you will like to see for how long can we use it. Can we use it for 6 hours, or can we use it for 8 hours or 10 days? So in use capacity test are used. So these are different type of tests. I am not going into detail of the calci-Sykes test because you don't really need to know it whenever you are going to evaluate it. In this, we are actually uh, testing it with some microorganism, and we do subcultures and check whether these microorganisms are being killed or not. Similarly, in use test is done for the disinfectant which is being used. You just take 1 ml of the disinfectant and 9 ml of broth is taken, and then you put certain amount of the drops on two culture plates with nutrient agar, and you incubate it and you look for colonies. If there are more than 5 colonies on either plate, it means that yes, your disinfectant is not working, it needs to be changed. It helps us in deciding the frequency of changing the disinfectant. Fine. Similarly, we use glutaraldehyde, very commonly used for endoscopes. So the endoscope should be completely immersed in this glutaraldehyde. And for checking the efficacy, these filter strips are available. You have to keep on seeing whether your disinfectant is actually effective or not. Manufacturer says, yes, you can use our glutaraldehyde or Sidex for 14 days after reconstitution. But in reality, it depends upon how many instruments you are putting inside. If you are putting too many instruments, they are dirty, they have organic load, your glutaraldehyde may become effective just after 7 days. So you may have to change it much earlier. So they help us in checking whether our solution is working or not working. Whenever you are using disinfectants, you have to discard them properly. These are chemicals, they should not go into drain. You should be neutralizing them by using a inactivator. For glutaraldehyde, you can use aqueous NaOH. Sometimes we buy from the manufacturer the glutaraldehyde inactivator. And if nothing is available, you can just double the dilution with water before discarding, because the flora which is present inside the drains will get destroyed. Flora, fauna. So this is about delivery of the sterile products for use in patient care depends not only on the sterilization or disinfection procedure you have used, but it depends upon cleaning, how you have put inside the tray, how you have packed it, loading, monitoring, and it is a continuous quality improvement. So, as microbiology students, you must know about steam sterilization, all methods of cold sterilization, what is the advantages and disadvantages of cold sterilization, the chemical sterilant, and quality assurance is also a short note. For sterilization, generally you get, sometimes you get a combined note, you have to write more about the sterilization. Thank you very much. Any questions? I will be happy to answer. Let me see the chat box. Dr. VK, is it mandatory to have ETO and CSST? It depends. Like I am working in a hospital where we buy all the fresh instruments. We are not having any reuse policy. If you are reusing your catheters, your ventilator tubings, you may need an ETO, but you may not need it also. Because cost effectivity is to be seen. It's always cheaper for us to buy a new product rather than buying an ETO. We have an ETO. Recently, we have stopped using it because the maintenance cost is very, very high. your cost of equipment, your AMC, CMC, the cartridges which we are using versus load. If you have a huge load, go for it. Otherwise, it is not mandatory. Nothing is mandatory. Autoclave is mandatory. Acha, why near the drain? Because the poorest efficacy is nearest the drain. Steam is coming from the coils which are placed there. Heat is being generated. Near the drain, we find that there will be maximum failure of temperature. So we put it near the drain. Okay. The maximum chances of detecting the failure in the air or in the temperature is near the drain. So we are putting it near the drain. So this brings me to end. Anything else you want to ask? So just have a very good evening. Enjoy yourself. Any other thing you want to ask me? I'm there. I don't know whether you have been giving unmuting rights. Waiting for one more minute. If any question in the chat box, I'll see. Yes. Thank you. Jayanti, can we close?